So we've struggled with our asthma outcomes in the UK for decades. Whatever we try, we still seem to have the worst outcomes amongst other countries in Europe and other countries across the world. And we want our outcomes to not be the worst, we want them to be the best, because that's what children with asthma deserve. And when we look across the northwest, we've really struggled to improve our outcomes, and they've been amongst the worst in Britain. And when we look at some of the reasons for this, it's quite multifactorial. So we know we need to improve the quality of care that we give, but we also know that we need to tackle the wider determinants of health. And it's heartbreaking how some people have to live in quite abject poverty, and we know that this drives quite a lot of the poor outcomes that we see in Liverpool and across the northwest. So this is the first time that we're able to visualise it and give a really robust and solid depiction of how unequal the outcomes are across the city, but also use quite sophisticated modelling techniques to identify what would happen if things got better. And then we can start to focus our efforts, and then we can start to see a difference. So that's why it's an award-winning project.
Yeah, I'm quite surprised. It was a bit unexpected, but yeah, it makes it worthwhile, the work that we're doing. And as innovation as a whole, it's just good to know that we're making an impact and it's actually getting recognised, because that's what we're here to do. And it's nice to see that us as clinical and non-clinical staff can work together in order to make that impact, which is what we're here to do basically.